Hello and welcome everyone. Myself Mizanur Rahman and today my topic of discussion is deep sea physiology. So today we will discuss about the introduction, then barometric pressure at different depths. Then we will discuss about the effect of high barometric pressure like nitrogen narcosis and its mechanism, symptoms, prevention and treatment. Then we will discuss about the decompression sickness like the definition, cause, symptoms, prevention and treatment. Then scuba. These will be our today's topic. So let's start. First introduction. In high altitude, the problem is with low atmospheric pressure, at especially barometric pressure. In the deep sea or mines, the problem is high barometric pressure, and increased pressure can create two major problems. One is compression effect on the body and internal organs, and decrease in volume of gases. So, what are the two major problems? One is compression effect on the body and internal organs, and number two is decrease in volume of gases. Then barometric pressure at different depths. At sea level, the barometric pressure is 760 mm per Hg, and which is referred as 1 atmosphere. At the depth of every 33 feet or about 10 meter, the pressure increases by 1 atmosphere. Thus, at the depth of 33 feet, the pressure is 2 atmosphere, and it is due to the air above water and the weight of water itself. And pressure at different depths are given in the table below. This is the table. You can see sea level 1 atmospheric pressure 33 feet, 2 atmospheric pressure 100 feet 3, 133 104, 133 5, 166 6, 207, 233 8, 266 9. So what are the effect of the subject? Sea level no effect, 2 atmospheric pressure almost no effect, 3 also almost no effect, but at the 4 symptoms of nitrogen narcosis appear. At 5 the lack of concentration becomes jovial and careless. Number 6 starts feeling drowsy. 7 feels fatigued, weak and careless. 8 loses power of judgment and unable to do skilled work, and 9 become unconscious. Now, effect of high barometric pressure like nitrogen narcosis. Narcosis refers to unconsciousness or stupor produced by drugs. Stupor refers to lethargy with suppression of sensation and feelings. Nitrogen narcosis means narcotic effect produced by nitrogen at high pressure. Nitrogen narcosis is common in deep sea divers who breathe compressed air under high pressure, and breathing compressed air is essential for a deep sea diver on an underwater tunnel worker. It is to equalize the surrounding high pressure acting on thoracic wall and abdomen. 80% of the atmospheric air is nitrogen. Being an inert gas, it does not produce any known effect on the function of the body at normal atmospheric pressure or sea level. When a person breathes pressurized air, as in deep sea, the narcotic effect of nitrogen appears, and it produces an altered mental state similar to alcoholic intoxication. Mechanism. Now, nitrogen is soluble in fat. During compression by high barometric pressure in deep sea, the nitrogen escapes from blood vessels and gets dissolved in the fat present in various parts of the body, especially the neuronal membranes. Dissolved nitrogen acts like an anesthetic agent, suppressing the neuronal excitability, and nitrogen remains in dissolved form in the fat till the person remains in the deep sea. Now, symptoms. First symptom starts appearing at a depth of 120 feet, and the person becomes very jovial, careless, and does not understand the seriousness of the condition. At the depth of 150 to 200 feet, the person becomes drowsy, and at 200 to 250 feet of depth, the person becomes extremely fatigued and weak. There is loss of concentration and judgment, and ability to perform skilled work or movements is also lost. And beyond the depth of 250 feet, the person becomes unconscious. Now, what is the prevention? Nitrogen narcosis can be prevented by mixing helium with oxygen And helium is used to use as a substitute for nitrogen to dilute oxygen during deep water diving. And helium also produces some effects like nausea and dizziness, but the adverse effects of helium are less severe than the nitrogen narcosis. Now, the nitrogen narcosis may be prevented by limiting the depth of dives. Effect of nitrogen narcosis may also be minimized by safe diving procedures such as proper maintenance of equipment and less work effort. In addition, alcohol consumption should be avoided 24 hours before diving. And treatment symptoms of nitrogen narcosis completely disappear when the diver returns to a depth of 60 feet, and there is no need to any further treatment since nitrogen narcosis does not have any hangover effect. However, the physician should be consulted if the diver loses consciousness. Now, decompression sickness. Definition: decompression sickness is the disorder that occurs when a person returns rapidly into a normal surroundings atmospheric pressure from the area of high atmospheric pressure like deep sea. It is also known as dysbarism, compressed air sickness, Caesian disease, and Bend's or diver's palsy. Now, cause: high barometric pressure at deep sea leads to compression of gases in the body, and compression reduces the volume of gases among the respiratory gases. Oxygen is utilized by tissue, carbon dioxide can be expired out, but nitrogen, which is present in high concentration 80% as an inert gas, so it is neither utilized nor expired. When nitrogen is compressed by high atmospheric pressure in deep sea, it escapes from blood vessels and enters the organs as it is a fat soluble, and it gets dissolved in the fat of the tissue and the tissue fluids, and it is very common in the brain tissues. As long as the person remains in deep sea, the nitrogen remains in solution and does not cause any problem. But if the person ascends rapidly and returns to the atmospheric pressure, decompression sickness occurs. Due to sudden return to atmospheric pressure, the nitrogen is decompressed and escapes from the tissue at a faster rate. Being a gas, it forms bubbles while escaping rapidly. The bubbles travels through the blood vessel and duct, and it may in many places the bubbles obstruct the blood flow and produces air embolism, leading to decompression sickness. And underground tunnel workers who use Caesian's pressurized chambers also develop decompression or Caesian's disease sickness. Now, pressure in the chamber is increased to prevent by entry of water inside, and decompression sickness also occur in a person who ascends up rapidly from sea level in the airplane without any precaution. Now, symptoms. Symptoms of decompression sickness are mainly due to the escape of nitrogen from tissue in the form of bubbles. Symptoms are severe pain in tissues, particularly the joints, produced by nitrogen bubbles in the myelin sheath of sensory nerve fibers. Then sensation of numbness, tingling and prickling, paresthesia and leaching. Temporary paralysis due to nitrogen bubbles in the myelin sheath of motor nerve fibers, and muscle cramps associated with severe pain, and occlusion of coronary arteries followed by coronary ischemia caused by bubbles in the blood. Then occlusion of blood vessel in brain and spinal cord also. Then damage of tissue of brain and spinal cord because of obstruction of blood vessels by the bubbles. Then dizziness, paralysis of muscle, shortness of breath, and choking occur. Now finally fatigue and unconsciousness and death. So now prevention. Decompression sickness is prevented by proper precautionary measures. While returning to mean sea level, the ascent should be very slow with short stay at regular intervals. Stepwise ascent allows nitrogen to come back to the blood without forming bubbles. It prevents the decompression sickness. And treatment: if a person is affected by decompression sickness, first recompression should be done. It is done by keeping the person in a recompression chamber, then he is brought back to atmospheric pressure by reducing the pressure slowly. And hyperbaric oxygen therapy may be useful also. Now, scuba. Scuba is self-contained underwater breathing apparatus. Is used by the deep sea divers and the underwater tunnel workers to prevent the ill effects of increased barometric pressure in deep sea or tunnels. This instrument can be easily carried and it contains air cylinders, valve system and a mask. By using this instrument, it is possible to breathe air or gas mixture without high pressure. And also because of this valve system, only the amount of air necessary during inspiration enters the mask and expired air is expelled out of the mask. And disadvantage of this instrument is that the person using this can remain in the sea or tunnel only for a short period. Especially beyond the depth of 150 feet, the person can stay only for few minutes. So this is our today's topic. We have completed an interesting topic today, that the deep sea physiology. So if you have any query or any doubt, you can comment down in the comment section, and do like, share and subscribe to my channel for supporting me and my channel. And thank you so much for watching.